the leading cause of emergency department presentations for patients over the age of 65. Furthermore, lots of falls occur within our hospital setting across Australia each year. Fortunately, we know that falls within our department are often predictable and preventable. Our team at the Royal Melbourne Hospital Emergency Department are committed to minimising your risk of sustaining a fall during your stay with us. All our staff conduct routine screening for factors that we know put you at risk of falls. Early within your stay, you will be asked a series of questions detailing your falls history and your mobility. Please inform your nursing staff if you have suffered a recent fall or trip at home, if you have walking problems that require a mobility aid or assistance to move safely, or if you have medical conditions such as incontinence or visual impairment. If you have noticed that your mobility has significantly deteriorated in comparison to usual, please flag this with your treating nurse. Within our emergency department, we are providing simple yet effective falls prevention strategies to ensure that you remain safe at all times. However, at Melbourne Health, we believe that everyone plays a role in falls prevention. If you are identified as a falls risk, an orange falls risk sign will be displayed within your cubicle. If you cannot see this falls risk sign, please ensure that you remind your nursing staff to display it so that everyone is aware that you are at risk. If you travel to the short stay unit, you will be provided with a pair of red non-slip socks that are to be worn at all times when you are on the move. Also, you may stay in a hospital bed that is particularly low to the ground. Please ensure that your bed is always at its lowest height by using your bed controls. We know that patients are particularly at risk of falls when they attempt to toilet, particularly when unsupervised. Please use your call bell and ensure that you alert a member of staff and wait for assistance to be provided. Also, if you have come into hospital without your regular walking aid, please inform one of our staff members so that we can provide one for you to use during your inpatient stay with us. Always ensure that your walking aid is within arm's reach, and if it's not, use your call bell to call for assistance. Please do not attempt to mobilise if you are feeling particularly unsafe, unsteady, dizzy, or simply have too much pain. Also, please do not forget to use your hearing aids, your glasses, and ensure that all your patient belongings remain safely stored to the corner of your room to make sure that your bed space is always clean and clutter-free. We strongly encourage that you, your family, and your carers have a discussion with any member of our emergency department team surrounding your falls prevention plan. We have falls prevention brochures that are available in a multitude of languages for you to keep on hand. Please identify your native language with your nursing staff member and keep one so that you can refer to this in the future. We strongly believe that by working together in implementing these simple strategies, we can ensure that you remain safe at all times during your stay with us in the emergency department at the Royal Melbourne Hospital.